Good morning, everyone, and thank you for joining us today. My name is Shannon Corbett, and I'm the MLA for Transcona. Before we begin, I'd like to honor the sacredness and importance of this land and of the ancestors that once walked where we are standing today. The Anishinaabe, the Anishinaabeg, the Dene, the Dakota, the Inuit, and the Anishinaabe nations, and the Red River Métis Nation, who paved the way to what is now known as Manitoba, home to all treaty people. Thank you, everyone, for being here today, and I would like to thank Carla Compton, the MLA for Tuxedo, and to Mike Mraz, the Minister of Innovation and Technology, and he's also the MLA for River Heights. Today's announcement is about supporting Manitobans, especially those living in personal care homes. Caring for our seniors is a priority because every Manitoban deserves to age with dignity. To begin, please welcome the Premier of Manitoba, the Honourable Wab Kinew.
All right, shalom. Today we're very proud to announce that this year's budget has an additional $5 million for higher quality food for personal care homes across Manitoba. We know that seniors built this province, and the way of life that we love so much is thanks to you. You are the teachers, you are the construction workers, you are the people who built the economy into the Manitoba that we know and love. You helped us have the quality of life that we enjoy today, and now it's time for us to make sure that you have the quality of life that you deserve. That means respect, that means dignity, and that means good food. And I was really happy to meet some of the workers here at the Simkin Center who do some of the meals here. And so there's more help for you to do the job that you love to do so much to help people in this wonderful community. When we look across Manitoba, we know that there are so many seniors in wonderful facilities like this one, and we want them all to have a good quality of life. At the same time, we know that we have to do more. And so we're also building new personal care homes in this year's budget, including a new personal care home not too far from here in the Bridgewater area of Winnipeg. So working together, we'll have new facilities, we'll have new staff on the front lines of healthcare, whether those are aides or nurses or physicians or healthcare professionals. And along the way, we'll make sure that you have healthy, nutritious, good tasting food. How about that? Happy to get into more detail soon, but on a personal level, I just want to say thanks to everybody who lives and works here at the Simkin Center for hosting us today. This is a beautiful, beautiful place to be. Such a wonderful community, so many happy residents and wonderful caring staff. So thanks for letting us take up a bit of space in your homes today. We're very happy to share some good news. Miigwech, merci, and shalom.
Thank you, Premier. Next, please welcome the Minister of Health, Seniors and Long-Term Care, Uzoma Asagwara.
Thanks, Shannon. Hi, everyone. Good morning. A really wonderful day and reason to be here. I want to thank everyone at Simkin. You folks are amazing, Laurie, the team. I want to give them a lot of credit for why we're here today. We've had the opportunity, myself, Minister Mraz, MLA Compton, many of our colleagues have had the opportunity to be here and visit, sit with the staff, sit with the residents, hear about your experiences, hear about how much you love this place that you call home. And we hear that when we travel the province and talk to seniors in their homes, in personal care homes. And you've got some wonderful advocates here in your leaders who have been making it really clear that we need to do more as a government to make sure that the food that you have is of the highest quality, of better nutrition, that there are more options, that you have choices, more choices as residents who live in these homes. And so we're listening. We are listening, government. This announcement of $5 million to improve the food quality in your homes is the direct result of residents and the people who care for you coming together and making your voices heard. And we're going to keep listening. We know that there's more to do, and that's why we're building new personal care homes, as you heard the Premier say. It's why we're reopening care home beds that were closed for years previously. You know, for years in Manitoba, we saw that not only were beds lost and personal care homes not built, but we saw that there weren't enough investments in making sure that where you live has the quality of support and resources, services, and food that you deserve. And the Premier is correct. Seniors built Manitoba. Seniors paved the way for us to call this beautiful province home. And so we're going to continue to do everything we can to make sure that you can age with dignity here in Manitoba. And having good, nutritious food, of course, is a fundamental part of that. So I want to thank all the folks here for allowing us the opportunity to share this great news with you today. I want to thank all of the care providers. I see you all in the back, behind the scenes here. Can we just, say thank you to those folks? They're so awesome. You are wonderful, wonderful people, and I have to say that what we're seeing across personal care homes in this province are people who just love Manitoba, who love Manitobans, showing up each and every day, providing the highest quality care to those who have helped create a province that is so near and dear to all of us. So I just want to say thank you all for being here today. This is a really important step forward for Manitoba. This kind of investment in improving food quality has not been seen in our province for many, many, many years. We are so proud to be the government that has taken this step with all of you. Thanks so much for being here. Let's keep working together.
Thank you, Minister. Now, please welcome the CEO of the Simkin Centre, Laurie Cerqueti, to speak.
Good morning, everyone, and welcome to the Simkin Centre. Thank you for being here today. I somehow have to think that we held this event here because I'm the only CEO that probably owns an orange dress, so here I am. I want to take a moment for us to focus on something that is absolutely essential to the people that live in our care homes, and that is food. Food is fundamental to all of us, and our residents, and for our residents, it is much more than nutrition. When you walk through a personal care home like this one, you quickly see that meals are not just part of the schedule. They are a central part of each resident's day. It's when people come together. It's when families connect. It's when a real sense of community is built. I see it every day. A resident recognizing a dish that they've loved for their whole life. Someone staying at the table a little bit longer because they're enjoying the meal in the moment. Those moments really matter, more than people often realize. That's why we're so encouraged that the government has heard concerns of the personal care home operators and care teams and residents, and has taken action on funding for food. This is an important first step, and I hope just the first step, and I hope that there's more to come. A step forward supporting sustainable operations in personal care homes is vital, and helping us continue to what we strive to do every single day to provide fresh and nutritious meals that reflect the people that live here and their culture. Here at the Simkin Centre and across care homes in Manitoba, staff are deeply committed to the residents' well-being. This investment strengthens that work and helps to create a better, more meaningful day-to-day experience for residents. We look forward to continuing to work with government to ensure that residents, the people who help build this province, and thank you, Premier, for saying the same thing, receive the very best care, and that they are always treated with dignity because they deserve nothing less. And you'll notice we have many of our residents in the audience today. Thank you for being here. Again, we're pleased with this first step. We're glad that the government has heard our concerns, and thank you everyone for being here today.
Thank you. That concludes the, that's okay. Thanks, Laura. Thank you everyone for attending the announcement today. That concludes the formal part of our announcement, and I open the floor to questions.
What kind of food are we talking about here? So we have some examples of how we're going to make the food more healthy.
Okay. Yeah.
Oh, Harry has a thought.
Carrie's got some opinions on that. Well, but actually, we're going to be flowing these dollars to the SDOs, so the regional health authorities, and they're going to be working directly with the homes to determine what makes sense for the homes, right? And so Laurie said it really, really well. You know, everyone's needs are going to be different. There's going to be cultural considerations, obviously dietary considerations, and a big part of why this investment is so important. It is about choice. It is about residents being able to have the opportunity to, express their desires in terms of what they want to eat and what meets their needs culturally, what's going to meet their needs in many different ways. And so this investment is really about supporting residents and having greater choice. And we expect the STOs, we know the STOs will work directly with the personal care homes to roll that out in the best way possible.
Will there be some plan that the regional health authorities are devising for some sort of consistency to elicit this kind of feedback on a PCH by PCH basis?
That's a great question. Yeah, of course. You know, the regional health authorities really work hard to have good lines of communication open with personal care homes and with their leadership and with the residents, quite frankly. So, you know, we're going to be expecting and asking them to really lean into those relationships and make sure that they've got a feedback loop for all the residents. You see all these wonderful residents who are here today are going to be able to have their opinions heard and talk to the folks that they communicate with regularly, you know, at their homes. And that will work its way to the regions as well, so they can work together to make sure that these investments are done in a way that really make the residents happy.
Given the number of care homes in Manitoba, the number of residents, the cost of food, how far will $5 million go?
Well, you know, I'm not sure if you've heard, we're taking the PSD off all groceries. And so, you know, we're taking a number of steps to ensure that, everybody's resources go a little bit further, right? And so this is a significant investment. We haven't seen an investment like this in improving food and personal care homes in many, many years. I think it was actually the media that reported not that long ago that maybe 2009, somewhere around there was the last time that we maybe saw something like this happen. So it's been long overdue, and we're looking forward to seeing what the personal care homes and what the regions come up with in terms of how they're going to invest those dollars. And we're just going to keep listening and making sure that any additional steps that we can take as we move forward, our government is able to do that.
Relative to the existing budget for food for seniors in personal care homes, where does $5 million stack up?
We can get you the exact numbers offline. I don't have that percentage off the top of my head, but it's substantial. $5 million in one go in terms of improving food quality is a big investment, but that's on top of all of the other investments that we've made. So our 25-26 budget, our last budget had about $130 million in personal care homes invested. Our first budget had over $40 million invested. So we are investing in the homes in which seniors who built this province live. We are investing in seniors in this province. We are investing in older adults being able to age with dignity, with respect, and with the care that they deserve. And that means investing in the bedside. It means investing in food. It means investing in services. And that's what we've been doing from day one. And that's what you'll see again in this budget. And we're going to continue to take that approach as we move forward.
There's been some calls within the sector for more funding for personal care. What would you say to those calls? Is the province doing enough to fund these?
You know, what we know is that personal care home operators do a tremendous amount of amazing work. Personal care home operators in Manitoba work very hard to make sure that residents' needs are met. They dealt with a government previously who for years gave them cuts to their operating dollars. For years gave them, 0.1%, essential cuts across the board to their funding. We have given, rightly, big investments into personal care homes since our first budget. And we're going to continue to invest to make sure that seniors in this province have the care, have the homes that they deserve. So this is an area for us as a government that is going to continue to be a priority. Seniors paved the way for us to be here today, and they deserve to have a government that they know is investing in making sure that they can age with dignity and with care and the ways that they want to, and the ways that they want to age in Manitoba. And that's exactly what we're going to continue to do.
Off topic for a second. The budget mentioned acute care, which is provided for ages.
Yes.
Can you talk a little bit about that? What is that? When will it be delivered, and where will the staff come from?
Yeah, I can tell you that we are actively hiring the staff for that unit now. I won't share too much here today, just because you're going to hear more about that soon, but that's a really big step forward. So a new unit at Health Sciences Center for the elderly is going to be a really important step forward for our province in terms of how care is provided. But we'll have more to share on that in the coming weeks. But I'm just really looking forward to, again, our government taking a really important step in making sure that no matter where you live, you're able to get care in this province that really meets your need if you're a senior or older adult.
This would be in addition to a similar geriatric program in Victoria.
I'll have more to share on that in the coming weeks.
Would staff be coming from that program to patients?
I love your enthusiasm around this. I can't wait to share all the information around this in the coming weeks.
What about the mental health zone? What's planned for HSC next to the
Yeah, so that's a really important step. Our government has been working with experts, with frontline providers, and listening to Manitobans, and we know that the needs around mental health are increasing, not decreasing. We know that there are many folks who present to Health Sciences Center and different sites who have acute mental health needs and need a proper pathway to get those needs met. So we are going to be standing up a dedicated mental health approach at Health Sciences Center and enhancing, creating more capacity there for staff to provide care to those patients, those Manitobans, in addition to something that is already launched at St. Boniface Hospital, which is dedicated cardiac care in their emergency department. So, if you're somebody in the ER at St. Boniface and you have a heart issue, you are now going to be able to be seen by a cardiac specialist in the emergency department, and then determine if you need to go up to a new unit that's being stood up, or if there's something they can do for you there, and then discharge you home in a more timely manner. So these zones are a new and improved way to make sure that if you go to an emergency room here in Winnipeg, you're going to get care in a more timely way, in a really specific way. It's going to bring pressure down in the waiting room, bring those waiting times down, but most importantly, improve care.
Is it based on a model that exists elsewhere?
Yeah, we've seen this kind of model in Ontario, in some emergency departments where they have some of the lowest wait times in Canada. But I would say equally, if not more important than those wait times, patient experiences are really positive. Patients love that model of care. Patients love being seen by a doctor in the emergency room more quickly, somebody who understands what their issue is and can get them the appropriate care in a more timely manner. And so that is a model that works. It's a model that we have heard loud and clear from experts here at home they want to see implemented. And so we're investing in making that happen.
Sorry, just to get back to the acute care for the elderly unit that's planned for HSC. Can you talk about how that will help to improve patient flows?
Sure. I mean, our government has added almost 380 net new beds to hospitals in Manitoba. And those are fully staffed beds in our hospitals in Manitoba. That's in addition to all of the transitional care unit beds, personal care home beds, all of these beds in community. And so whenever we're adding beds to a hospital, in particular when we know that too often there are seniors who are in hospital beds who would much rather and much more appropriately be healing in the community, healing someplace else where they can get the right level of care. So we're creating beds in our hospitals that are going to better meet people's needs, get them out of emergency departments where they're waiting far too long, and support their healing journey through the healthcare system in a much more timely way, with the goal being getting you back to your community where you can heal at home, or getting you to that personal care home where you can continue to heal. But this is all about supporting better flow. And again, first and foremost, it's about making sure that patients have a much better healthcare experience and are getting care in a much more timely way. Oh, thank you.
Well done. Well done.
That's self-ministry.
The funding, whatever the amount will be for this facility, I mean, how do you envision using that to provide expanded meal options or potentially healthier options for residents?
I know choice will be a big thing that residents really want to see. I know I often hear that people want more fresh fruit. So those are two things that come to mind immediately for me, but we really have to see what kind of dollars it will mean for our site. We do run a significant deficit in our food budget every year, between $200,000 and $300,000. So, yeah, we'll just have to see how much it actually ends up being.
And that deficit, I mean, can you talk maybe a little bit about shifting funds around, and what does that impact elsewhere in terms of services?
Every year it's a challenge to balance the budget, and this year will be no exception. We will be running a deficit again this year. So we, like I mentioned in my remarks, that we do need to keep continuing having conversations with government about how this sector can be helped. And like I said, this is an important first step, but it can't be the only step.
When did this money start to flow?
Oh, great question.
Oh, good question.
Food is medicine. I think Hippocrates said that. And for seniors to have fresh food, to have culturally appropriate food for Passover or Christmas or Indigenous ceremonies is a way that we can help keep people healthy in the body, but also in the mind and in the spirit for many, many years. And so that's why we're making this investment. The money will flow as soon as the budget passes. So the budget debate will be happening over the next 2 sitting weeks in the legislature, and we need to pass the budget implementation bill, as it's called, before the House rises in June, so that this can take effect, so that the sales tax can come off at the grocery store, so that free transit for youth can take effect. So as long as we get our budget through the legislature by the end of June, then the dollars will flow. So thanks for the question.
We're short of nurses on the 3rd floor.
Oh, the 3rd
And
floor.
you're chasing nurses away that live 10 minutes away.
10 minutes away.
You know, they're working 3 days a week. You can't work 3 days a week in this. So they gotta go somewhere else for a couple of days. They're chasing staff away.
Well, we're working hard to make sure that there's enough nurses for the front lines of the healthcare system as we need it. So thank you to all the nurses and the healthcare aides and other folks that we said hello to on the way in here today. Our message is that help is coming. Help is on the way. So far, we've been able to hire 4,000 new staff since the election. That means about 1,500 new nurses. But this is a big province, 1.5 million people now. And so for us to get to the staffing level where we need it to be, it's going to take more work for sure. But the good news is we have been able to hire and retain more nurses in Manitoba. So now we just have to maintain those efforts. It's a lot done, a lot more to do, but there's also a lot to lose if we ever go back to what was happening before. Right on. Well, thanks so much, everybody. Maybe I'll just say in French. Aujourd'hui, nous sommes très heureux d'annoncer 5 millions de dollars de plus pour la nourriture pour les aînés qui habitent chez les centres de soins pour les aînés dans le Manitoba. La nourriture, c'est un médecin. C'est une façon d'appuyer la santé au niveau physique, mental, spirituel en même temps. Merci beaucoup.
Thanks, Premier. Thanks, Gary. Great. I heard you say that.